Hello everyone, this is Ashley Ramos and today I will be teaching you all about the telehealth perspectives and more. So to get us started, I will be explaining in brief the four perspectives, which are provider, patient, technology/business, and policy. And I will be providing an overview of what they are, but I will be focusing more specifically on how they interact with each other. So to get us started, the provider focuses on internal as well as external components. They focus on things such as starting the company, training staff, making sure everything complies to law, but most importantly, they focus on providing care to you, the patient. And that leads us into our second perspective, the patient perspective. And the patient perspective is all about satisfaction and accessibility. What needs to be done to ensure you have the best and easiest visit with our company and your provider? Could it be that you need help navigating through the interface? Do you need help getting access to technology to be able to help with your visit or to be even able to connect to your provider? Your provider can help you with that. And so, how are these two connected? Well, they rely on each other deeply. One can't exist without the other. The provider has to make sure that they have everything required to service you, and without you, there's no service to give. There wouldn't be a company. We as a provider have to make sure we give you everything needed to make sure you have a great experience. And our two other perspectives are the policy perspective and the business/technology perspective. So the policy perspective obviously focuses on policies and regulations. And an example that I'll be using is the funding grant, specifically the Telehealth Network Grant Program. And according to the self-titled website Telehealth Network Grant Program, published in 2020, basically this grant gave funding to companies who were willing to outreach to more rural areas, specifically for tele-emergency services such as behavioral health, tele-emergency, and chronic illnesses. And the business/technology perspective focuses on financial perspectives such as how are you going to get your funding? How are you relying to get paid? Are you relying on the customer directly paying you? Do you want to get paid through insurance? What are your opinions on that? And the business models are things such as meta-analysis and target audiences. Who will you be focusing on? This could also bring in market competitors. You could focus on behavioral health, which is like an emerging service that you could get into because there isn't that much competitive companies. Or you can focus on chronic illnesses, which is also an emerging service. And how are these two connected? Well, obviously, the business and policy are really connected because of funding options. Without these policies that help you have money to fund your program, where are you going to be getting that money from? And also the need to comply with federal laws. As a service, you can't just use whatever technology you want. You have to comply to federal laws that require you to use certain machines or certain laptops, especially for patient data. Like for HIPAA, you have to have an interface that protects your patient's identity, your patient's information. So, according to law, what type of technology could you use for that? And how are all these perspectives interconnected? Whether or not it's visible to the common person, all sections and perspectives help each other to function smoothly. I might not have mentioned how each specific perspective helps with each other. As you saw, I focused on patient and provider and technology and business. But as you can see on the figure on the left, on this octagon, these are all pieces to form the bigger shape. like relations and regulations. You have to have a good like relation with the law to so that they can trust you, so that they can know that you're doing what you need to do to be able to comply to law. And finance and resources. Where are you getting that money for your resources? Who are you seeking out to be able to help you get that money? And accountability and leadership. As providers, we have to hold accountability for our actions. If we do something wrong, we have to report it. We have to hold accountability for it. And impact on missing services, as I mentioned, they all depend on each other deeply. Each perspective relies on one another. A more simple way to think about it would be that image we all saw as kids of all the people holding each other's hands around the world. We all have to work together to be able to function. If one of us is missing, that could really damage the rest of us, such as provider and patient. Without the provider, you can't have your service. Who's going to help you in times of need? And without the patient, there is no service to give. Who are we going to help? And policy and business, we need that funding sometimes from the business perspective. But without policy grants, how are we going to get that money? And business and technology, who are we buying our technology from? We need to form those relations. And if there's no technology, there's no way for us to provide care to you, for the patient, and way more. And for the future of telehealth, for emerging companies, I'm focusing on Amazon One Medical. As you all, I'm sure you know, Amazon's a really huge company. They've dipped their hands in a lot of services, such as obviously the one they're most known for, online shopping. They've also opened some grocery stores in some areas, and now with the emergence of telehealth companies, they want some of that money too. So, as of lately, they've been starting a medical service. I believe it was unveiled in 2024, so it's about 2 years old. And this could rise in a lot of competition for other companies since Amazon's such a huge company. And something essential for the future of telehealth is the need for policy expansion. As I mentioned before, policymakers didn't think this was going to be a lasting thing. They believed this was only going to last through the pandemic and that it was only going to last about a year or so. And as we all probably know, it did not last only a year. And even then, after the pandemic, a lot of people still use telehealth because it just became a part of their normal routine. But the problem with policy is, if you guys didn't know, Medicare will stop covering for telehealth visits in 2027. That's only now 1 year away. And for a lot of people, especially in rural areas, they depend on Medicare to be able to cover their visits. And even the companies themselves, they rely on Medicare providing that source of income for them. So if Medicare cuts off their coverage, a lot of people will be left without care. So an important aspect for the future of telehealth, not only for telehealth, but a lot of services other than telehealth, we need that expansion of Medicare coverage or even making their services cheaper and more accessible. And here are lists of my references. And thank you for letting me explain telehealth. And I hope I piqued your interest to be able to use or invest in telehealth in the future. Thank you.